Hello everyone. In this video, we're going to talk about the synthesis of thyroid hormones, which I will explain to you in a step-by-step process. Okay, so look at this diagram here. This is all you need to remember. I will explain this to you in this very simple diagram. Okay, and so over here we have the blood vessel. Over here we have the thyroid follicular cell, and this is the colloid. So this is how I've represented this. This is the cell and this is the colloid. Now, the first step will be sodium and iodide, not iodine yet, iodide from the blood vessel or from the blood will be transported inside the thyroid follicular cell by this sodium iodide symporter. Okay, first step is transport of sodium and iodide inside the thyroid follicular cell by sodium iodide symporter. Both of them go in the same direction, hence symporter. Symporter means same direction. Both molecules are transported in the same direction. That is why sodium iodide symporter. That is the first step. As you can see over here, this step is called iodide trapping. Trapping of iodide from the blood inside the thyroid follicular cell is the first step. Now, second step will be transfer of iodide into the colloid by pendrin. Now see, on this side of the thyroid follicular cell, we have a transporter called pendrin. What this pendrin does is that it takes this iodine and transports it into colloid, the thyroid ka colloid. Okay, so that is the second step. Transport of iodine into the colloid by this pendrin transporter. Third step will be oxidation. Oxidation of iodide into iodine. So iodide becomes iodine, and this is done by the enzyme thyroid peroxidase. The enzyme thyroid peroxidase catalyzes the conversion of iodide into iodine and causes the oxidation of iodide. Now in the fourth step, we have something called thyroglobulin. And this thyroglobulin is rich in tyrosine residues. It's rich in a lot of tyrosine molecules. What will happen in the fourth step is iodination of the tyrosine present in the thyroglobulin. So this iodine will combine with the tyrosine present in thyroglobulin and it will form this structure. The tyrosine will form monoiodotyrosine and diiodotyrosine. All the tyrosine in the thyroglobulin will get converted to monoiodotyrosine and diiodotyrosine depending on how many iodine get attached to the tyrosine. That is the fourth step, iodination of tyrosine. Fifth step is coupling. Coupling is where this monoiodotyrosine and diiodotyrosine combine to form the various thyroid hormones. So monoiodotyrosine or MIT will combine with DIT or diiodotyrosine to form T3. Okay, so MIT plus DIT gives you T3. DIT and DIT will give you T4. You can remember this by the number of iodine as well. Okay, so MIT is mono and then DIT is di. So 1 plus 2 gives you T3. Okay, 1 plus 2 gives you T3. DIT and DIT, which is both di, will obviously give you T4. And then if we reverse this reaction, if we combine DIT plus MIT, in this order it will give you reverse T3. So 1 plus 2 will give you T3, 2 plus 1 will give you reverse T3. And this entire process is called coupling. This is the fifth step, coupling of MIT and DIT to form the thyroid hormones. In the next step, these thyroid hormones T3, T4 and reverse T3 are taken inside the cell. It is combined with thyroglobulin. All these hormones are combined with thyroglobulin, and in the sixth step, this thyroglobulin is taken inside the thyroid follicular cell. It is taken back inside by the process of endocytosis. So endocytosis is the next step, the sixth step. In the seventh step, proteolysis of this thyroglobulin will release the thyroid hormones inside the thyroid follicular cell. So the seventh step is proteolysis. Next, when the hormones are required, they are secreted into the blood. So the eighth step is secretion of the thyroid hormones into the blood when the thyroid hormones are required. And one more step is when in the blood T4 gets converted to T3 by a process called deiodination. So T4 gets converted into T3 because T3 is the more active part, the more active hormone. So the conversion of T4 to T3 is called deiodination. Now if we revise once more, the first step is iodide trapping by the sodium iodide symporter. Next step is transfer of iodide into the colloid by the spendrin. The third step is oxidation by thyroid peroxidase, oxidation of iodide into iodine. Fourth step is iodination of the tyrosine compounds which are present in thyroglobulin and formation of MIT and DIT. Fifth step is coupling of these MIT and DIT in different combinations to form the thyroid hormones. Sixth step is endocytosis of the thyroid globulin combined with the thyroid hormones into the thyroid follicular cell. Seventh step is the proteolysis of thyroglobulin to release T3 and T4 inside the thyroid follicular cell. Eighth step is secretion into the blood when the hormones are required. And an additional step is deiodination of T4 to T3. Now the thyroid hormones, once they are synthesized, T3 and T4, they have to be transported in the blood from the thyroid gland to the target cell, and that happens by three proteins. First is thyroid binding globulin, second is transthyretin, third is albumin. These are the three proteins that are involved in the transport of thyroid hormones, and among that, thyroid binding globulin has the least capacity to bind with thyroid hormones, but it has the maximum affinity to bind to them. Least capacity but maximum affinity to thyroid hormones. But albumin has the maximum capacity but least affinity to bind with the thyroid hormones. So least capacity is thyroid binding globulin, maximum capacity is albumin, but maximum affinity is thyroid binding globulin and least affinity is albumin. Now we know that there are two types of thyroid hormones, T4 and T3. Let us look at the basic differences between these two. Now if we talk about the plasma level, T4 is more in plasma level than T3. T3 is less. Secretion of T4 is more and secretion of T3 is less per day. If we look at the distribution, T4 is more extracellular and T3 is located intracellularly. What happens with T4 is that it gets converted to T3 extracellularly in the blood vessels, that is. So plasma level is more for T4, secretion is more and distribution is extracellular. T4 is maximum protein bound. Most of the T4 is going to be protein bound, approximately 99.98%. And for T3, it's 99.8%. It is 99.8% protein bound, but it is still lesser than T4. So if T4 is maximum protein bound, obviously the free amount will be less. The amount of free hormone will be less in T4 and more in T3. That is why T3 is the more metabolically active hormone and T4 is less metabolically active. That is, it is the active form. T3 is the active form. In duration of action, T4 takes longer. It lasts longer, but it also acts slowly. The duration is slower. That is, it takes time to start showing its action, but it lasts for a long time. Whereas in T3, it starts earlier, but it lasts for a very short time. And if we look at the T half or the half-life, T4 has a longer half-life and T3 has a shorter half-life. Now if we talk about the regulation of thyroid hormones, you have the hypothalamus, which secretes the hormone TRH or thyrotropin releasing hormone. This TRH will stimulate thyrotrope cells in the anterior pituitary, and this anterior pituitary will secrete the hormone thyroid stimulating hormone or TSH. Now this TSH acts on TSH receptor of the thyroid gland. Thyroid gland has TSH receptors. TSH will bind to those receptors and bring about the production of the thyroid hormones T3 and T4. Now, a few things that you need to know about this receptor is that the TSH receptor acts by GS mechanism or G stimulatory mechanism. And how this GS works is by increasing adenylyl cyclase and increasing the level of CAMP or cyclic AMP. Okay, so the mechanism is GS and it increases adenylyl cyclase, G stimulatory. And what this subsequently does in the thyroid gland, what does TSH do in the thyroid gland is that it increases iodide trapping in the process of synthesis of thyroid hormones. It will increase the process of iodide trapping. It will increase the step of iodination of tyrosine. If you remember, the tyrosine gets iodinated or bound to iodine to form MIT and DIT. So TSH will increase the iodination of tyrosine. It will increase endocytosis of the thyroglobulin back into the thyroid follicle cells. It will increase proteolysis, that is separation of the thyroid hormones from the thyroglobulin. It will also increase thyroglobulin synthesis, which will obviously lead to more of a thyroid hormone synthesis. And it will also increase the number and size of thyroid cells. So this is what is responsible for thyroid hyperplasia. It will increase the number and size of thyroid cells. This is all that TSH does. Increases iodide trapping, increases iodination of tyrosine, increases endocytosis, proteolysis, thyroglobulin synthesis, and increases the number and size of thyroid cells. Now this was the stimulatory action of this TSH on the thyroid to produce thyroid hormones. These thyroid hormones in turn will have a negative feedback mechanism on the anterior pituitary and on the hypothalamus. So they will inhibit the production of TRH and TSH. So TSH will increase the production of thyroid hormones, but once thyroid hormones are there, they will bring about a negative feedback effect and reduce the production of TRH and TSH. Now let's look at the actions of thyroid hormones. So thyroid hormone will lead to increased production of heat and increased basal metabolic rate. So overall they increase heat and metabolism in the body. If we look at protein metabolism, protein synthesis is increased, which means it is anabolic, protein anabolic. In lipid metabolism, there is an increased synthesis of cholesterol and there is lipolysis. So they will cause increased synthesis of cholesterol and lipolysis. Overall, lipids will be broken down. In carbohydrate metabolism, thyroid hormones are diabetogenic. They will increase blood glucose levels and make the person prone to diabetes mellitus. If we look at growth, the thyroid hormones are very important for skeletal maturation and also for tissue differentiation. So they help in growth in a child. They are very important for growth of a child because they are important for skeletal maturation and tissue differentiation. In the CNS, now thyroid hormones are very important for development of the CNS because in a child they will cause myelination of nerves and development of synapses. So they are overall very important for maturation of CNS. In the CVS, thyroid hormones will increase heart rate and they will increase force of contraction. In the gastrointestinal tract, intestinal motility is increased, which means the food and gastric contents will pass quicker through the intestines. If we look at the bone marrow, if thyroid hormones are decreased, there will be a decreased erythropoiesis in the bone marrow leading to anemia. And when thyroid hormones are increased, there is increased erythropoiesis. In the skin, they will lead to dilation of blood vessels of the skin and because of dilation there will be more blood flow towards the skin, causing the skin to feel warm and moist. So skin becomes warm and moist. In gonads, they are important for maturation and for secondary sexual characters.